wondered about what EMS is and what the different levels are, well, stay tuned because today we're going to be talking about that.
Ninja paramedic guy, ninja paramedic guy, ninja paramedic guy. Medics rule. Ninja paramedic guy.
Accidents are the cause of trauma.
Ninja paramedic guy. Ninja
Rescue 804 arriving on scene.
Ninja paramedic guy.
Let's start by answering the first question. What is EMS? EMS is the Emergency Medical Services. In other words, whenever you do something stupid and hurt yourself, we're the people you call to come help.
Oh God, Fred! Fred!
What's going on here?
He's dead, Jim.
This is a dummy.
I know.
Alright, now, today we're going to be discussing about the different levels of EMS. In EMS, there are 6 levels that we will be discussing today that are recognized throughout various territories and municipalities, but not necessarily in all. They are Emergency Medical Responder, or EMR, EMT, or Emergency Medical Technician, Advanced EMT, or AEMT for short, Paramedic, Critical Care Paramedic, and the Community Paramedic, also sometimes known as an Advanced Practice Paramedic. Now, what I have before me is the Ninja's Guide to EMS. What the guide has to say about emergency medical responders, which is the first level we'll be talking about today, is as follows.
With next to no medical training, these are the first people to arrive on scene and summon additional help.
Emergency medical responders are trained in basic life-saving skills. These can include basic airway maneuvers, the use of OPAs, use of BBMs, oxygen therapy with nasal cannulas and non-breathers, suctioning of the airway, using a Mark 1 kit on either themselves or another rescuer who responds. They can perform CPR. They are able to use AEDs. They can hold C-spine, manually stabilize fractures, initiate bleeding control, perform emergency moves, and assist in a non-complicated birth of a child. On to the next level, we're going to see what the Ninja's Guide has to say about EMTs.
Congratulations! You have made it to the ambulance, but you're still a noob.
The skills that EMTs have, in addition to what an EMR can perform, include basic anatomy and physiology knowledge, use of nasopharyngeal airways, use of simple transport ventilators or manually triggered ventilators, assisting patient with any prescribed medications, giving aspirin and oral glucose as needed and indicated, using mechanical patient restraints, splinting, immobilization of the C-spine and back, use of tourniquets, use of pneumatic anti-shock garments, use of mechanical CPR machines, and assisting with the complicated birth. Now, moving on to the next level, the Advanced EMT.
Like EMTs, but advanced. That's right, you're 2% more useful. You get to play with the stabbing needles, and the best part, you can use some drugs. And I do mean some drugs. I'm talking to you, Fred.
Additional skills that advanced EMTs have, in addition to what an EMT and EMR have, are as follows. They have advanced knowledge of anatomy and physiology. They can use blind insertion airway devices such as the Combi 2 or the King Vision, depending on what the medical directors allow. They can perform an ALS assessment, start IVs, start IOs in a pediatric patient. They can give IV fluids, give nitro tablets. They can give epi, sub-Q, or IM for anaphylactic reactions. They can give glucagon to diabetics, and they can give D50 to diabetics. They can use any inhaled beta agonists such as atropine or albuterol. They can use Narcan to reverse a suspected narcotics overdose. And finally, in some places, they are allowed to use nitrous oxide for pain relief. Moving on to the next level, we have the paramedics. The Ninja's Guide to EMS has this to say on the subject of paramedics.
Ultimately responsible for everyone on scene and constantly buried under a mound of paperwork, the world ends with you. You get to play with all the cool toys and give all the good drugs. Just don't let it go to your head, you damn paragod.
In addition to the previous skills listed on the lower levels, paramedics are able to do endotracheal and nasotracheal intubations. They're able to do a needle cricothyroidectomy, which involves putting a needle into the cricothyroid membrane to clear an obstructed airway. They can reach in with manual forceps, manually removing any airway obstructions. They can do a needle decompression of the chest, a gastric decompression. They can use IOs in any patients they see fit. They have a large collection of emergency medications that they can carry, depending on what their medical director will and will not allow. They can access an indwelling catheter and IV ports. They can perform any IV infusion drugs that their medical directors will allow. They can monitor blood and blood products. They can cardiovert, defibrillate, interpret 12 leads, perform pacing, administer CPAP, BiPAP, and use advanced ventilators. These last two levels of EMS that we will be discussing are not universally accepted, and they vary depending on where you are. There are some places where one of these may exist and the other may not, and there are some places where both of these may exist. These both require additional training. The next level up from a paramedic is known as a critical care paramedic. The Ninja's Guide to EMS has this to say on critical care paramedics.
With this power-up, you become a true force of nature. At this level, you get to fly in both helicopters and planes.
At the level of critical care paramedic, you have a much larger access of drugs that your medical director will allow you to carry. Additionally, some municipalities allow critical care paramedics to perform rapid sequence intubations or chemically assisted intubations where other paramedics might not be able to. The final level in EMS that we'll be discussing today is known as the advanced practice or community paramedic. Ninja's Guide has this to say on that matter.
In this shiny brand new field of EMS, you're now a stone's throw away from being an actual doctor.
The difference between a critical care versus a advanced practice or community paramedic is that the advanced practice and community medics tend to work directly with the doctor via phone line. Now, this means that you'll usually go out, act as the doctor's clinician in the field, assess the patient, and then finally perform treatments as prescribed by the doctor out in the field. Then release the patient and allow them to stay at home instead of going into the hospital. Well, that's all the time we have for today. Until next time, see ya.
Ninja paramedic guy, ninja paramedic guy, ninja paramedic guy. Medics rule. Ninja paramedic guy.
Accidents are the cause of trauma.
Ninja paramedic guy. Ninja
Rescue 804, riding on scene.
Ninja paramedic guy.